So welcome back to part 2 of our CBT Toolbox stress management unit. So we left off about steps in CBT. So another one is become aware of your thoughts, emotions, and beliefs about these problems. So sometimes we have these like thoughts, or we like kind of like say them out loud about kind of bring us down, like oh, I'm not pretty enough, or I'm not smart enough. So it's like those kind of like our thoughts and emotions and beliefs about the problem. So once you identify the problems to work on, your therapist will encourage you to share your thoughts about them. This may include observing what you tell yourself about an experience, which is self-talk, your interpretation, the meaning of a situation. So you kind of interpret it in like your own view, which it might not be but the situation might not be what you think it is to others outside. So sometimes like miscommunication can happen too. And your beliefs about yourself and other people and events. Your therapist may suggest that you keep a journal of your thoughts. So again, this does require some homework, and you're working on things by yourself too. CBT also helps you identify negative or inaccurate thinking. So that kind of helps, like, those are like the thoughts that cause us to have behaviors, even though it's probably not what not happening in real life. Meaning, like, if there's a miscommunication about like an argument and you thought like the person meant something else, but you took it the wrong way, that's kind of like an example. So it helps to recognize patterns of thinking and behavior that may be contributing to your problem. Your therapist may ask you to pay attention to your physical, emotional, and behavioral responses in different situations. Reshape negative or inaccurate thinking. So what it means by reshaping is your therapist will likely encourage you to ask yourself whether you view your view of situations based on fact or an inaccurate perception of what's going on. So sometimes like we get like very like rattled up and very emotional about something, but then it's like, and we kind of blow it out of proportion. But when we're like kind of looking back on it, we realize that it's like, oh, it's like, okay, I misinterpreted what that person was saying, and that caused me to become upset. Or it's like I just suffered a loss from like a death, or I've lost my job, or I've lost my living arrangement. So now it's like that's causing me to react to something that I wouldn't exactly react to if I was in a better situation. This step can be difficult. It is really hard for us to kind of reshape our thinking, especially when it's like something that we've developed over time just as a coping mechanism. You may have long-standing ways of thinking about your life and yourself. And with practice and helpful thinking and behavior patterns, we will become habit and won't take as much effort. So as to anything, like when you're trying to help yourself and create habits, it does take a while. So that's kind of, and this reshaping of negative or inaccurate thinking does take a while. So some risk of cognitive behavioral therapy is, in general, there's little risk in getting CBT, but you may feel emotionally uncomfortable at times because it is bringing up and kind of pointing out those inaccurate thinking, and it makes people feel self-conscious. And this is because CBT can cause you to explore painful feelings, emotions, and experiences. You may cry, get upset, or feel angry during a challenging session. You may also feel physically drained. Some forms of CBT, such as exposure therapy, this is kind of something that's type of therapy that's used a lot in PTSD or even anxiety, for phobias too, and anxiety. And I'll stop right there and finish up in the next part.